They mocked her pink combat leg before they ever saw what her hands could do. At Fort Liberty Military Medical Center, dawn came with rotor blades rain on the glass and stretchers rolling in from the storm. Captain Evelyn Harper heard the whispers before she reached the trauma wing. Combat Barbie, a liability, a surgeon who should have stayed behind a desk. But the thing they laughed at was not decoration. It was not weakness. It was a secret built from pain, steel, and survival. And when a child's hand was dying on the operating table, when the best surgeons in the room began to shake, Evelyn stood perfectly still. This story is about judgment courage and the kind of strength people only notice when it saves a life. Stay with me until the end and tell me in the comments where you're watching from. By the time the trauma alarm faded into the walls, Captain Evelyn Harper was already moving with the rest of the surgical team, her pink combat prosthetic striking the floor in that clean, measured rhythm everyone at Fort Liberty knew before they knew her voice. Click, step, click, step. It was a sound that followed her through every corridor in the hospital. Some people heard it and moved aside with respect. Most heard it and looked down before they looked at her face. A few tried not to stare and failed anyway. Evie had learned to read the difference between curiosity, pity, and contempt with the same precision she used to read a trauma scan. Fort Liberty Military Medical Center sat on the edge of Fayetteville, North Carolina, close enough to the base that helicopters came in low over the pines and shook the windows during night shifts. The hospital never truly slept. It breathed in cycles of sirens, radio calls, rotor wash, and whispered prayers. Soldiers arrived with blast injuries from training accidents. Military spouses came in with complicated pregnancies. Children of deployed parents came through the emergency doors with fevers, broken arms, and frightened eyes. On some nights, wounded personnel arrived from overseas before the blood on their uniforms had fully dried. Evie knew that world. She had lived inside it long before she wore a white coat. Before medical school, before the surgical residency, before the pink prosthetic, she had been a combat medic with a trauma bag pressed against her ribs and desert dust in her teeth. She had learned medicine with bullets cracking over concrete walls. She had learned pressure by kneeling in the dirt beside men who called for their mothers while she packed wounds with trembling hands and ordered herself not to tremble. She had learned the difference between panic and urgency. Panic wasted motion. Urgency saved lives. That was what she carried into every operating room. Not that anyone cared when they saw the leg. At Fort Liberty, she was officially Captain Evelyn Harper Medical Corps first-year surgical resident, prior enlisted combat medic, decorated veteran graduate of Johns Hopkins School of Medicine, and holder of a graduate degree in biomedical engineering from Georgia Tech. Her file was thick with recommendations from battlefield surgeons, professors, trauma chiefs, and officers who had watched her work under conditions that broke seasoned doctors. Unofficially, she was the woman with the pink leg. The leg became the story before she could. It was bright enough to catch the eye beneath scrub pants. Not pastel, not soft. A bold matte pink over carbon fiber with a black titanium joint and a narrow polished line along the shin where the sensor array sat hidden under the shell. She had chosen the color herself after the Army prosthetics technician brought out samples meant to blend with skin tone. The technician had said most patients want something natural looking. Evie had looked at the tray of beige covers and felt something cold move through her chest. Natural looking, as if her body had become a thing that needed apology. She had picked the pink shell from a specialty catalog 2 weeks later. The technician had blinked when he saw it. "You sure about that?" Evie had answered. "I'm sure about being seen." At first, the color helped. During physical therapy, it gave her something to own. During those early months when she hated the mirror, and hated the phantom fire in her missing foot, and hated every careless person who said she was lucky to be alive, the pink leg became a small act of rebellion. It told the room she was not trying to disappear. Then she entered surgical residency, and the color became ammunition. People rarely attacked the strongest of you directly. They circled it. They made jokes. They softened cruelty into humor so they could deny it later. In the cafeteria, residents lowered their voices when she passed. In the elevator, officers glanced at her rank, then her leg, then away. In the scrub room, someone once asked whether the prosthetic made it harder to stand through long cases. Someone else asked if she needed a stool. A nurse trying to be kind once offered to carry a stack of charts, even though Evie had been hauling wounded men through smoke years before that nurse ever held a trauma pager. Evie always smiled. The smile was not warmth. It was armor. That morning after the mass casualty alert was downgraded and the first wave of injuries had been sorted, Evie stood at the trauma bay sink washing blood from her forearms. Rain traced long lines down the windows. The corridor outside smelled of wet wool antiseptic and burned coffee. Somewhere nearby, a child cried in short, exhausted bursts. Major Grant Callahan walked in with his surgical cap pushed back and his gloves snapped off in one hand. He was tall, clean-cut and polished in the way men became polished when no one had ever laughed at their right to stand in a room. His uniform always fit, his boots always shone, his confidence had the smooth surface of something inherited and reinforced by applause. He leaned against the counter beside her. "Good hustle in Bay 3, he said. Evie did not look up. Was that a compliment or a trap? Just an observation. Then I'll try to survive it. Callahan smiled, but not with his eyes. You know Harper people would give you less grief if you stopped acting like everyone is against you. She shut off the water and reached for a towel. People would give me less grief if they stopped giving me grief. That leg draws attention. No. People choose to stare. You painted it pink. I did. At an army hospital. Yes. Subtle wasn't available. Evie dried her hands slowly. There's nothing subtle about losing a limb, Major. For a moment something shifted in his face. Not regret, not quite. More like irritation that she had made the joke harder to enjoy. He straightened. Colonel Cross wants you in skills lab at 1100. Microsurgical drills. I saw the schedule. Try not to take it personally if he watches your stance. Evie turned toward him. Try not to take it personally if I outperform you. Callahan's smile thinned. You're very sure of yourself for someone still proving she can handle this program, and you're very comfortable for someone who thinks rank is the same as skill. He stepped closer, close enough that his voice lowered. Careful, Captain. Evie looked at the space between them, then back at his face. I usually am. She walked out before he could answer the sound of her prosthetic filling the silence behind her. Click. Step. Click. Step. Colonel Nathan Cross watched from the far end of the corridor, half hidden near the surgical board. He had seen enough to know there was trouble between them. He had also seen enough trouble in his career to know that most of it became useful if aimed in the right direction. Cross was not a cruel man. Evie knew that. Cruelty had a scent. It was eager. It leaned forward. It enjoyed itself. Cross was different. He was disciplined, careful, and harder to dismiss. He carried his bias like a service weapon, holstered but always present. His doubt had procedure around it. His questions came dressed as standards. His hesitation sounded like patient safety. That made it more dangerous. He had been chief of surgery at Fort Liberty for 6 years. Before that, he had run combat surgical teams in Iraq and Afghanistan. There were rumors he once performed a vascular repair during a mortar attack with dust falling into the sterile field and a nurse holding a flashlight over the wound. Evie believed it. Cross had the eyes of a man who had seen bodies opened in places where medicine had to move faster than fear. He respected competence. He just had to be convinced her competence was real. 2 weeks earlier, during her formal intake meeting, he had sat behind his desk with her file open in front of him. His office overlooked the helicopter pad. A Black Hawk had been lifting off outside the glass, trembling softly behind him. Captain Harper, he had said, your record is exceptional. Thank you, sir. Your trauma evaluations are unusually strong. Yes, sir. Your engineering background is also impressive. Thank you, sir. He had closed the file. But surgery at this level is not a resume. Evie had kept her hands folded in her lap. No, sir. It is endurance, balance, control, the ability to stand for hours when your back is on fire and your hands are tired and the patient is still bleeding. I understand that. His gaze had dropped briefly to the pink prosthetic visible beneath her uniform pants. Do you, Evie, remembered how still the room became? She had heard worse in cruder language, but the clean language hurt differently. It carried authority. It sat in a chair with rank on its collar and asked whether she knew what her own body could survive. She had answered, I understood that before I lost the leg. I understand it better now. Cross had studied her for a long moment. Then you understand why I'll be watching closely. Yes, sir. I am not trying to insult you. No, sir. I am trying to protect patients. Evie had nodded once. So am I. That was where the meeting had ended. No yelling, no accusation, nothing she could report. Just the quiet lowering of expectation. Now in the skills lab, that same expectation settled over her shoulders like a lead apron. The lab sat on the third floor behind a keypad door and 2 glass panels etched with the Army medical crest. It had 6 practice stations, each equipped with microscopes, synthetic tissue blocks, micro-instruments, and narrow tubing designed to mimic blood vessels. A camera mounted above each station fed to monitors along the wall. Every small movement became large on the screen. That was the danger of microsurgery. It revealed the truth. Hands that looked steady at the table became unstable under magnification. A heartbeat became a tremor. A breath became drift. A moment of ego became a torn vessel. The residents gathered in silence as Colonel Cross entered. Callahan stood near the front with his arms crossed. 2 interns whispered behind him until Cross glanced their way. The whispering stopped. Cross addressed the room. Today we are evaluating vessel repair under sustained magnification. Precision, efficiency, tissue respect, not security, and tremor control. You will each perform a simulated arterial repair on a 2-millimeter vessel. He looked around the room. This is not a competition. Callahan's eyes moved to Evie. Evie stared at the microscope. Cross continued. But the patient never cares about your intentions, only your result. Callahan went first. He moved with practiced confidence, rolling his shoulders once before leaning into the microscope. His hand positioning was good. His instrument control was better than most. He placed the first stitch cleanly, then the second. On the monitor, the vessel edges came together. By the 4th minute, a faint tremor appeared in his right hand. Nothing dramatic, nothing shameful, normal physiology. The kind of tiny instability most surgeons managed with breath control and repetition. Cross watched without expression. Callahan finished and stepped back. Cross examined the repair. Acceptable, good spacing. Slight tissue drag on the final knot. Tremor appeared under time pressure but remained controlled. Callahan nodded. Thank you, sir. He removed his gloves and glanced at Evie. Your turn, Captain. The room shifted with the silent appetite of people waiting to see whether a rumor would become a fall. Evie stepped to the station. She felt every eye move downward first, always the leg, never the hands. She positioned herself in front of the microscope. Her right foot found the floor, her prosthetic aligned beside it. There was a faint click as weight settled into the socket. Inside the leg systems remained dormant. She did not need them fully engaged for this drill, not yet. She only needed the baseline balance she had trained with for thousands of hours. She placed her hands under the scope. The instruments were familiar. Needle driver, forceps, micro scissors. Her breathing slowed. Not forced calm, real calm, the kind built through repetition pain and the stubborn refusal to let fear own the room. She began. The first stitch passed cleanly through the synthetic vessel. On the monitor, it looked almost unreal. No wobble, no search, no hesitation. She tied the knot. Second stitch, third, fourth. The lab was so quiet she could hear the air handling system above the ceiling. An intern shifted his weight. Callahan did not move. Evie finished before the timer sounded. Cross stepped forward. He inspected the repair under the scope, then looked at the monitor. His face did not change, but his silence lengthened. Callahan noticed. So did Evie. Cross finally said, technically strong, 2 words that sounded like a door almost opening. Then he added, your upper body tension is compensating for lower limb instability. The door closed. Evie lifted her eyes. My posture did not compromise the repair. Cross met her gaze. Posture affects endurance. Then test endurance. A few residents looked away. Cross's voice lowered. Everything in surgery matters, Captain, including what you want the room to ignore. Evie felt heat rise behind her ribs. She thought of the 11 failed prototypes in her apartment. The nights her residual limb bled into the liner because she had trained too long. The morning she woke with phantom pain sharp enough to make speech impossible. The hours she spent rebuilding balance from nothing, while men like Callahan practiced arrogance in clean shoes. She wanted to say all of it. Instead, she removed her gloves. Yes, sir. Callahan smiled barely. Evie left the lab without looking at him. The rest of the day moved around her in fragments: rounds, chart reviews, a wound debridement, a consult for a fractured femur, a 15-minute lunch she did not eat. She caught pieces of conversation wherever she went. Cross said her repair was good. Good isn't the same as safe. Still, did you see her hands? I saw the leg. That was the whole problem placed naked in 5 words. I saw the leg. By evening, the rain had returned. Evie drove home through wet streets lined with military housing, strip malls, gas stations, and pine trees bending under the storm. Her apartment was on the 2nd floor of a plain brick building 15 minutes from base. She chose it because the stairs forced her to stay honest about strength. Elevators made people soft in ways they did not notice. Inside, she locked the door, dropped her bag by the couch, and stood still until the hospital sounds drained from her body. No monitors, no boots, no whispers, only rain. She went to the bedroom and sat on the edge of the bed. The process of removing the prosthetic was automatic now. Release valve, outer strap, socket lock, weight shift, lift. The leg came free with a soft mechanical sigh. Her residual limb ached instantly as if the pain had been waiting politely for permission. Evie placed the prosthetic on the workbench beside her bed. The bench was not decorative. It was a battlefield of parts. Circuit boards, sensor housings, titanium screws, calibration cables, neural interface pads, old notebooks stained with coffee, and a framed photograph of Evie in uniform before the accident. In the photo, she stood beside a field ambulance in Afghanistan, sunburned and grinning, both biological legs planted in dust. She rarely looked at it. Above the bench, 11 prototype shells lined a shelf. Version 1 had been too heavy. It gave her balance, but after 30 minutes her hip burned so badly she could not climb stairs. Version 2 had responded too slowly. It corrected movement after she had already shifted, which made walking feel like arguing with her own body. Version 3 caused nerve feedback so intense that she passed out in the lab and woke up with blood on her forehead from hitting the floor. Version 4 cracked at the knee joint. Version 5 overheated. Version 6 worked until she tried to stand at a surgical table for more than 2 hours. Version 7 shook under load. Version 8 damaged the skin around her socket. Version 9 could stabilize her stance but not her core. Version 10 was good enough for walking, not good enough for surgery. Version 11 came close enough to break her heart. Then came version 12. Pink. Lighter than the others. Stronger. Quieter. Designed around the truth no textbook had taught her until she lost the leg. Stability was not stillness. Stability was constant correction so precise the world never saw the movement. Evie connected the prosthetic to her diagnostic tablet. The screen lit up with data streams. Load distribution, socket pressure, neural signal quality, gyroscope alignment, core compensation response, tremor mapping. At the top of the screen, the system name appeared. Anchor, Adaptive Neural Compensation and Harmonic Oscillation Reduction. The acronym had started as a joke during a sleepless night. Then it stayed because it was exactly what the leg did. It anchored her, not to the past, to the work. She activated a training simulation. A digital model of a surgical stance appeared built from motion capture of her own body. Tiny red lines pulsed where ordinary human tremor traveled from heel to pelvis, from pelvis to spine, from spine to shoulder, from shoulder into hand. Heartbeat, breath, muscle fiber, fatigue. The body was never still. Surgeons learned to work around that truth. Evie had built a system that worked through it. When anchor engaged, the red lines softened. The prosthetic predicted micro-shifts before they reached her upper body. It adjusted through the socket hip alignment and core engagement. It did not move her hands for her. It did not choose where to cut. It did not replace judgment. It simply kept the storm from reaching the needle. Evie stared at the screen until the numbers blurred. Her phone buzzed. A message from her older brother, Sam. Long day. She typed back. Normal. His reply came fast. Normal for regular humans or normal for you? Evie almost smiled. Normal for me. A pause, then Sam wrote, That means terrible. Eat something. She set the phone down without answering. On her desk sat a small wooden box she had not opened in months. She opened it now. Inside was the Purple Heart. She did not wear a folded photograph and a strip of faded cloth from the uniform she had been wearing the day of the blast. The official record called it an improvised explosive device during a convoy medical response outside Kandahar. Clean words, administrative words, words that made violence sound organized. The memory was not clean. She remembered heat first, then sound, then dirt in her mouth, then someone screaming for a medic, which was strange because she was the medic. She remembered looking down and not understanding why her left boot was wrong. Not missing, not exactly. Wrong. Crushed beneath twisted metal and blood and the ugly angles of a body no longer obeying its original design. She remembered Staff Sergeant Miller pressing both hands above her knee while shouting at her to stay awake. She remembered saying absurdly, "My hands are fine." Miller had thought she was delirious. Maybe she was. But even then, with the world breaking apart, some clear of her had reached for the only thing that mattered. My hands are fine. 3 days later at Walter Reed, she woke up to white lights and a woman standing beside her bed. Lieutenant Colonel Ann Reeves, trauma surgeon, mentor. The first person who told her the truth without wrapping it in pity. Evie had asked how bad Reeves had said below the knee. "We tried everything." Evie remembered turning her head away. Reeves let the silence exist. Then she said, "You lost of your leg, Evie. You did not lose your hands." At the time, Evie hated her for saying it. Later, it became the sentence she built a life around. Now, in her apartment, Evie closed the box and looked back at the pink prosthetic. People thought the color was vanity. They thought the limp was weakness. They thought the leg was evidence that she had been broken and allowed back into the hospital through kindness. No one saw the engineering. No one saw the training scars. No one saw the night she stood at the kitchen counter threading sutures through grape skins while her residual limbs screamed. No one saw her practicing stance correction until sunrise. No one saw her recalibrating neural sensors with tears of pain on her face and a stopwatch ticking beside her. They saw the leg. Fine, let them. The next morning began before dawn. Fort Liberty emerged from the storm under a low gray sky. Water stood in shallow pools across the parking lot. The helicopter pad gleamed black. Evie arrived with coffee she would forget to drink, and a stiffness in her hip she refused to acknowledge. At the security entrance, a young private held the door for her, then looked embarrassed when she thanked him. In the locker room, 2 interns stopped talking when she entered. Evie changed into scrubs without a word. As she tied her surgical shoes, she saw a small note taped inside her locker. No signature. Nice repair yesterday. She stared at it for a moment, then removed it and tucked it into the back of the locker, not because it mattered, because maybe it did. Morning rounds started in the surgical conference room. Residents filled the seats. Nurses stood along the back wall. Colonel Cross entered carrying a tablet followed by Callahan and the night trauma fellow. Cross looked more tired than usual. That meant the case list was bad. He dimmed the lights. The main screen lit up with scans, names, injuries, lab values, operating room availability. The meeting moved fast. A soldier with a shattered radius, a contractor with abdominal bleeding, a military spouse with gallbladder sepsis. Then Cross stopped on the final case. The screen changed. A child's hand appeared in pale, skeletal outline, delicate and terrible. Evie sat forward before anyone spoke. The arteries were faint on the imaging. Too faint. The second and third digits showed compromised flow. Soft tissue swelling crowded the structures. The injury pattern was worse than the summary suggested. Cross said Mia Walker, 8 years old, dependent of Master Sergeant Daniel Walker, currently deployed. Crush injury to the right hand after a base vehicle collision during yesterday's storm. Initial stabilization complete. Vascular compromise evolving overnight. Callahan studied the image. Evie studied it harder. Cross continued. She needs operative exploration, vascular repair, possible nerve reconstruction. Time sensitive. Major Callahan, you will take lead under my supervision. Callahan nodded once. Yes, sir. Evie's eyes remained on the screen. Something cold and precise moved through her. This was not a teaching case, not safely. Cross began to move to the next slide. Evie spoke. Sir. The room turned. Cross looked at her. Captain Harper Evie kept her voice measured. The arterial involvement is more extensive than the initial note. There's likely retraction along the digital vessels and the swelling is narrowing the working field. If perfusion drops further, the second and third fingers may not tolerate a prolonged repair. Callahan did not look away from the screen. I can read imaging, Captain. Evie did not answer him. She looked at Cross. This case needs the steadiest hands available. Now Callahan turned. And you believe those are yours? Evie met his stare. I believe Mia Walker's hand should not be used to prove anyone's pride. The air in the conference room hardened. Cross's jaw tightened, not in anger exactly, but in warning. Major Callahan is assigned lead. Captain Harper, you will be available if needed. Callahan smiled. The meeting moved on, but Evie kept looking at the scan until Cross turned off the screen. Outside the conference room, the hallway had filled with the ordinary sounds of a hospital pretending it was not built on emergencies. Phones rang. Carts rattled. A janitor polished a floor that would be stained again before noon. At the far end of the corridor, Evie saw a woman standing alone with a child's backpack clutched to her chest. Rachel Walker, Mia's mother. Her eyes were red, but she stood straight as if posture were the last piece of control she had left. The backpack was small and purple with a laminated music card clipped to the zipper. Mia's first piano solo. Evie slowed. Rachel looked up. For one brief second, she did what almost everyone did. She saw the pink leg. Then she looked at Evie's face. Are you one of the surgeons? Evie said. Yes, ma'am. Rachel swallowed. My daughter keeps asking if she'll still be able to play. Evie looked at the backpack. The hospital lights hummed overhead. Somewhere behind them, a monitor alarm chirped and stopped. Evie answered carefully. We're going to fight for every finger. Rachel closed her eyes. It was not a promise, but it was not nothing. From behind, Evie Callahan's voice cut in. Mrs. Walker, I'm Major Callahan. I'll be leading Mia's surgery. Rachel turned toward him. Evie stepped aside. Callahan offered the polished version of himself. Calm tone, firm handshake, controlled confidence. He explained the procedure in words that were accurate and clean. Rachel nodded at the right moments, but her fingers kept tightening around the backpack strap. Evie watched Callahan's hands as he spoke. They were steady. For now. Cross appeared beside them. Captain Harper, he said quietly a word. Evie followed him a few steps down the hall. He stopped near a window overlooking the rain-dark helicopter pad. You challenged my assignment in front of the team. Yes, sir. Do not make that a habit. No, sir, unless you are certain. Evie looked through the glass at the empty landing zone. I was certain. Cross studied her profile. Then say what you mean. She turned back to him. Major Callahan is good. He is not good enough for that hand if the case deteriorates. That is a serious assessment. Yes, sir, based on what his tremor under magnification, his response to pressure, his need to push through instead of pause. Cross said nothing. Evie continued quieter now. And the scan. Cross looked toward the conference room where Mia's image had disappeared from the screen, but not from either of their minds. You are asking me to remove a senior resident from a major case and replace him with a first-year resident. I am asking you to put the patient above the hierarchy. His eyes sharpened. That is an easy sentence to say when you are the one who wants the case. Evie absorbed the hit, then said, Yes, sir, it is. Cross waited. Evie did not retreat. He finally said, Be available. I will be. Cross left her by the window. Evie stood there for another moment, watching rainwater slide down the glass in crooked lines. In the reflection, she could see herself. Scrubs, badge, tired eyes. Pink prosthetic. A surgeon shaped by war and still treated as if the visible wound were the most important thing about her. Behind her, Rachel Walker bent down as a nurse wheeled Mia toward the before-surgery holding area. Mia was awake small beneath the blanket, her injured hand wrapped in white gauze. As the gurney passed, the child turned her head. Her eyes found the pink leg. Then Evie. Is that your real leg? Mia asked. Rachel looked horrified. Mia. Evie stepped closer to the gurney. It's my real leg because it belongs to me. Mia thought about that. Does it hurt sometimes? Are you scared when it hurts? Evie glanced at Rachel, then back at the girl. Sometimes. Mia lifted her wrapped hand an inch. I'm scared now. The hallway seemed to narrow around them. Evie rested one hand lightly on the side rail. That makes sense. Callahan appeared at the head of the gurney, ready to move. Mia looked at Evie again. If my hand works, I have a piano song. Evie's throat tightened before she could stop it. What song, Claire de Lune? But only the easy part. Evie smiled. The easy is still music. Mia nodded, satisfied for the moment. The nurse began rolling her toward the operating suite. Evie remained still as the gurney passed. Callahan walked beside it, shoulders squared, already wearing the face of the surgeon in command. Cross followed a few steps behind. At the double doors, Callahan glanced back at Evie. There was no joke this time, only challenge. The doors opened. Cold surgical light spilled into the hallway. Evie heard the first instrument tray being rolled into place, the low voice of the anesthesiologist, the muted beep of a monitor being connected to a child whose hand still held the shape of a song. She looked down once at the pink prosthetic. The diagnostic pulse beneath the shell was silent, waiting. Then she walked toward the scrub room. The scrub room was colder than the hallway, and for a moment Evelyn Harper stood alone beneath the fluorescent lights, listening to water drum against the narrow window above the sinks. Beyond the wall, Mia Walker was being prepared for surgery. 8 years old, right hand crushed, blood flow weakening, a piano song waiting somewhere inside fingers that might never move the same way again. Evie turned the faucet with her elbow and began to scrub. The ritual usually calmed her. Fingertips first, palms, wrists, forearms, every motion exact. Every motion repeated so many times it belonged less to memory than to muscle. But that morning something sharp moved beneath the rhythm. She had seen the scan. Callahan had seen it too, but he had looked at it through confidence. Evie had looked at it through consequence. That was the difference. The vessels in Mia's hand were not just damaged, they were angry. Swollen tissue pressed around them. Blood flow through the second and third fingers had weakened overnight, and the digital arteries looked thin and irregular, as if the injury had torn them deeper into the soft tissue than the first report admitted. A surgeon could enter that hand believing it was a repair and discover too late that it was a rescue. Evie rinsed the soap from her arms. Across the scrub room glass she could see Callahan inside operating room 4. He stood near the instrument table while the nurses counted. His mask was already tied. His cap was dark blue. His posture was flawless. He looked like a recruitment poster for military surgery. That had always been his advantage. People trusted the shape of him before he did anything. The circulating nurse opened the door with her shoulder and leaned into the scrub room. Captain Harper, Colonel Cross wants you observing from the side table unless Major Callahan requests assistance. Evie nodded. Understood. The nurse hesitated. Her name was Dana Ellis, an Army nurse with 15 years in trauma and eyes that missed almost nothing. She lowered her voice. That hand is bad. Evie looked at her. Yes. Worse than they're saying yes. Dana glanced through the glass at Callahan. Then I hope he knows when to ask. Evie shut off the water. Hope is not a surgical plan. Dana held her gaze for 1 second, then disappeared back into the operating room. Evie dried her hands and entered. The room was bright enough to erase shadows. Stainless steel reflected light in hard lines. The microscope stood over the surgical field like a weighting machine. Monitors glowed green and blue. The anesthesiologist adjusted a line near Mia's head, speaking softly, even though the child was already under. Some doctors did that. Evie respected it. Bodies heard more than medicine understood. Mia looked impossibly small beneath the drapes. Only her right arm was exposed, resting on a padded board, the hand swollen and discolored under the prep solution. The fingers had a faint bluish cast. Not dead, not safe. Evie's eyes moved to the pulse oximeter on Mia's finger, then to the Doppler probe, then to the set of micro-instruments arranged near the field. Needle holders, fine forceps, vessel dilators, tiny clamps, sutures thinner than hair. Everything necessary to save a hand, everything necessary to ruin one. Callahan looked up as she entered. Comfortable spot for you by the wall, Captain. Evie stopped beside the secondary table. I can see the field from here. Good. Try to enjoy the education. Colonel Cross entered before she could answer. He had scrubbed, but not gowned. He would supervise from the gallery, at first close enough to intervene, far enough to let Callahan lead. His gaze swept the room. Status, the anesthesiologist answered. Patient stable, pressure holding, mild hypothermia corrected. Tourniquet ready but not inflated, antibiotics in, blood available, Dana added, instruments counted, microscope calibrated, vascular set open. Cross looked at Callahan. Major, state your plan. Callahan stepped to the field. Explore the wound, identify damaged digital arteries, debride, non-viable tissue repair, arterial flow to the second and third digits, assess nerve continuity and reconstruct as needed. Expected complications: vessel retraction spasm, swelling thrombosis, tissue loss, threshold to call for assistance. Callahan paused, just long enough for Evie to notice. If visualization is compromised or perfusion cannot be restored. Cross held his stare. Do not let pride become of the wound. Callahan's eyes flicked toward Evie, then back to Cross. Yes, sir. Evie stepped closer to her assigned position. Her prosthetic settled under her with a quiet click hidden beneath her scrub pants, still inactive except for normal balance support. She could feel the dormant system like a held breath. Callahan began. The first incision was clean. He moved with discipline, no wasted motion, no unnecessary force. For the first 20 minutes, the room had the calm focus of a procedure going well. The skin opened. The crushed tissue separated. Hematoma was cleared. Damaged structures came into view under magnification. Callahan identified the first digital artery. It was bruised, but intact. He relaxed almost imperceptibly. Evie did not. She was watching the deeper field. The second vessel was harder to find. The swelling had changed the anatomy. Tissue planes that should have opened cleanly clung to each other. Blood seeped slowly from torn edges, not enough to panic anyone, enough to blur detail. Callahan adjusted the microscope. Dana dabbed the field. The anesthesiologist called out stable numbers. Cross watched from behind the glass. Evie could feel him watching everyone. Callahan found the second artery after another 15 minutes. It was damaged, partially torn, with the distal end curling into swollen tissue. He exhaled through his nose. Clamp. Dana placed the micro-clamp into his hand. The first repair began. Evie watched his fingers, not the field. Surgeons revealed themselves in the moments between movements, in the way they paused, in the way they corrected, in the way frustration entered their hands before it entered their voice. Callahan's first 2 sutures were good. The third required adjustment. The fourth dragged slightly through the vessel wall. Cross leaned closer to the gallery glass. Callahan noticed and stiffened. Evie saw the chain begin. Pressure became tension, tension became force, force became tremor, small, manageable, human. But Mia's artery was not forgiving. Your angle is closing, Evie said quietly. Callahan did not look away from the microscope. I know my angle. Your distal edge is folding. I said I know. Cross's voice came through the speaker from the gallery. Major, reset your position. Callahan withdrew the needle and rolled his shoulders. Resetting. He adjusted the chair, flexed his fingers, and returned to the field. The repair held. For a while, color improved slightly in Mia's index finger. The nurse noted it. The anesthesiologist relaxed a fraction. Callahan's breathing steadied. Then came the third vessel, the one Evie had warned them about. It was not where it should have been. The crushed tissue had swallowed it. The proximal end was buried deep, half hidden under swollen muscle and torn connective tissue. The distal end had retracted toward the base of the finger. Between them lay a gap too wide for an easy repair and too delicate for impatience. Callahan went still. The room understood without anyone saying it. This was no longer a simple teaching case. Cross entered the operating room but stayed outside the sterile field. Talk me through it. Callahan's voice remained controlled. Digital artery retracted. Tissue swelling significant. I can mobilize both ends and attempt primary repair, Evie said. There may be too much tension. Callahan's head turned slightly. Captain Harper is observing, not consulting. Cross said Captain Harper is a surgeon in this room. If she sees something, she says it. Callahan's jaw shifted beneath the mask. Yes, sir. Evie kept her eyes on the field. If you force a primary repair under tension, it may tear when flow returns. You may need a vein graft or deeper mobilization before you commit. Callahan looked into the microscope again. I can get length. Evie said nothing. The words had been placed in the room. That was all she could do. Callahan began mobilizing the vessel ends. The work grew slower. Outside, thunder rolled over the hospital. The sound came faintly through walls built to resist storms, gunfire, and panic. A second later, the overhead lights flickered. Every face in the room lifted. The backup generator engaged with a low vibration beneath the floor. The lights stabilized. The anesthesiologist checked the monitors. "We're good." Dana looked toward the door. "Storm's getting worse." Cross glanced at the clock. "Any update on outside vascular backup?" A tech near the wall checked a tablet. "Roads near the south gate are flooding. Duke team is delayed. Medevac is grounded until the cells move east." Cross's expression did not change, but the room felt smaller. Callahan heard it too. No cavalry, no transfer, no outside expert arriving in the next hour to clean up a mistake. Mia Walker's hand had only the people in that room. Callahan continued. 1 hour passed, then another. The first signs of fatigue were almost invisible. A slower reach for the instrument. A longer pause before tying, a shift of shoulders, a flex of the right thumb. The body trying to hide what the body could not avoid. Evie felt her own pulse slow. She was no longer angry. Anger was too loud for this room. She was watching math. Time plus pressure plus magnification plus ego. The result was predictable. Callahan placed another suture. This one landed shallow. Dana's eyes moved to Evie, then back to the field. Callahan muttered, "I need better exposure." Dana adjusted suction. "Field is clear." "No, it's not." Evie heard the edge in his voice. Cross stepped closer. "Major, pause and breathe." "I'm fine." "Pause anyway." Callahan withdrew both instruments and sat back. He blinked hard, then adjusted the microscope again. Evie could see sweat at his temple beneath the cap. In the hallway beyond the operating suite, Rachel Walker waited with the purple backpack in her lap. Evie could picture her there too clearly, sitting under military portraits and fluorescent light, checking her phone even though there was no update, looking at the recital card clipped to the zipper, trying not to imagine a future where her daughter's hand closed halfway and never opened fully again. Evie looked back to the field. Mia's fingers had lost some color. The anesthesiologist noticed. "Perfusion to the third digit is dropping." Callahan's shoulders tightened. "I'm restoring flow now," Cross said, "then do it slowly." The warning carried weight. Callahan heard it as doubt. His next movement was too fast. The needle entered the vessel wall at a poor angle. Not disastrous. Not yet. He corrected, but the correction tugged the tissue. The vessel edge stretched pale and thin. Evie's hand twitched once at her side. Not from tremor, from the urge to step in. Callahan tied the knot. Too much tension. The vessel narrowed. Dana said softly, "Flow still weak." "I can see that." Callahan snapped. Cross's voice turned hard. "Major." Callahan inhaled. Apologies, but apologies did not restore perfusion. He tried to revise the stitch. His hand hovered under the microscope. Under normal vision, it would have looked steady enough. Under magnification, the tremor appeared like a small electrical current running through his fingers. Evie saw it. Cross saw it. Callahan knew they saw it. That knowledge made it worse. He withdrew the needle, flexed his fingers, then returned. The tremor remained. The room began to change around him. No one panicked. Military hospitals did not reward panic, but every professional in that room tightened into readiness. Dana shifted closer to the vascular tray. The anesthesiologist prepared medication without being asked. Cross moved one step nearer to the sterile field. Evie stayed where she was. The hardest of being right was watching the damage happen before permission arrived. Callahan adjusted again. His voice came low, directed at himself. "Hold steady." Evie heard it. So did Cross. The phrase chilled her. A surgeon should never have to command his hands where to be. Not at that level. Not in that field. Not with a child's blood supply collapsing beneath the lens. Cross said, "Major, take 30 seconds. I don't need 30 seconds. You will take them." Callahan sat back. The room waited. The monitor beeped in steady rhythm. Rain hit the windows somewhere beyond the sealed walls. The generator hummed beneath the floor like a second heart. Evie looked down at her prosthetic. The pink shell was barely visible under the sterile cover near her ankle. A faint diagnostic light pulsed once, hidden from everyone but her. Anchor was ready. She was ready, but readiness meant nothing without authority. Callahan leaned forward again before the full 30 seconds ended. Cross said, "Major, I have the field." He reached for the needle driver. Dana placed it in his palm. Evie saw the nurse hesitate before letting go. Callahan entered the microscope view. The vessel walls waited fragile and swollen, the gap between them shining with diluted blood. He tried to place the next suture. His wrist trembled. The needle tip drifted. A breath caught somewhere in the room. Callahan corrected. Too late. The needle descended toward the artery at the wrong angle, and Mia Walker's hand lay open beneath the light, silent and small, while every person in the room watched the space between skill and disaster disappear. The needle touched the artery wrong. Not enough to look violent. Not enough for anyone outside that room to understand the damage. Under the microscope, it was only a small tear, a thin red opening in a vessel no wider than thread. But inside Mia Walker's hand, that tiny mistake became a flood. Blood filled the field. Callahan froze for half a second. Half a second was too long. Dana moved first. Suction. The anesthesiologist looked up from the monitors. Perfusion is dropping. Callahan leaned closer to the scope. I can control it. His voice was tight but still proud. He pressed too hard with the forceps and the tissue slipped away from him. The vessel retracted into the swollen bed of Mia's hand, vanishing beneath bruised muscle and torn fascia. Cross stepped into the sterile zone. Major, stop. Callahan did not move back. I have it. No, you don't. Step away. The words cracked through the operating room like a command on a battlefield. Callahan pulled his hands back, but his shoulders stayed rigid. His eyes were locked on the microscope screen, watching the blood collect where his repair had been. Cross took his place. Micro-suction. Fresh field. Give me the fine forceps. Dana passed the instruments into his hands. Her face gave nothing away. That was why the best nurses frightened young surgeons. They did not need to raise their voices to show that they knew exactly when a case was falling apart. Evie stood near the side table, every nerve in her body awake. Mia's third finger was turning pale. The monitor kept its steady rhythm indifferent and merciless. Cross worked with the calm of a man who had spent decades making decisions in rooms where men bled faster than prayers could move. He cleared the field, found the damaged tissue, and traced the path where the artery had disappeared. For several minutes it looked possible. The room followed his hands. Even Callahan seemed to breathe again. Then the vessel slipped deeper. Cross adjusted. His left hand trembled once, barely, humanly. Evie saw it because she knew what she was looking for. It was not weakness. It was age-fatigue adrenaline, pulse breath, the body reminding even a master surgeon that flesh was never perfectly still. Cross was good enough to hide it from most eyes. The microscope did not care about reputation. He tried again. The artery resisted. The tissue around it had swollen tighter from the bleeding and the earlier manipulation. Every correction made the field worse. Every minute without flow narrowed Mia's future. The anesthesiologist spoke. Third digit saturation is falling. Cross did not look away from the field. How much time? Not enough to waste. Dana suctioned again. Callahan stood behind Cross, face pale above his mask. His hands hung at his sides like they belonged to someone else. Evie stepped forward. Sir. Cross stayed on the microscope. Not now. I can repair it. The room went still around the sound of her voice. Cross withdrew the instrument half an inch, but did not turn. Captain Harper, this is not the moment for ambition. It is the moment for blood flow. Callahan looked at her sharply. You think this is about you? Evie did not look at him. No, that's why I'm speaking. Cross finally lifted his eyes from the scope. The overhead light cut deep lines into his face. You are a first-year resident. Yes, sir. This is a pediatric microvascular salvage after vessel injury and field contamination. Yes, sir. You understand that if you fail, this child may lose function permanently. Evie's voice was quiet. She may lose it if I don't try. The room held its breath. Somewhere beyond the doors, Rachel Walker waited with a purple backpack in her lap. Evie could see it as clearly as if the wall were glass. A mother pressing her fingers into cheap nylon trying to keep herself from falling, while strangers decided the future shape of her child's hand. Cross looked at Mia's fingers. Pale, cold, silent. Then he looked at Evie's hands. They were not clenched. They were not restless. They hung beside her body with an unnatural calm, as if the storm in the room had not reached them. Cross said, "Scrub in." Callahan took a step forward. "Sir, you can't be serious." Cross turned on him. "I gave you the case. You lost the field. Stand down." Callahan's eyes flashed, then dropped. Yes, sir. Evie moved to the scrub sink. The world narrowed. Water, soap, fingertips, palms, wrists, forearms. She did not hurry in the way frightened people hurried. She moved fast because every motion had already been chosen. Her breathing slowed until the fear in her chest became something clean and useful. The nurse tied her gown. Gloves snapped into place. She stepped toward the microscope. Her prosthetic clicked once beneath the sterile drape. Inside the socket, Anchor woke fully. A faint pressure spread along her residual limb. Not pain, contact, recognition. The neural interface read the signals at the end of her nerves and answered with micro-adjustments too small for the room to see. Sensors in the ankle and knee measured load. Gyroscopes mapped sway. The core response system activated through her hip and lower back, not moving her body so much as removing the noise from it. Heartbeat tremor. Compensated. Respiratory drift. Compensated. Muscle tension mapped and dampened. Weight shift. Corrected before it traveled upward. Evie settled into the stance she had built in pain prototype by prototype, night by night. The tremor inside her body met the machine she had designed for it, and vanished before it reached her hands. She leaned into the microscope. The world became red tissue white light, and the narrow opening where Mia's artery had disappeared. Field, Evie said. Dana suctioned. Microforceps. The instrument touched her palm. Evie entered the wound. No one spoke. On the monitor, her hands appeared enormous and impossible. The forceps moved into the field without tremor. Not less tremor. Not controlled tremor. None that the eye could catch. Cross saw it first. His face changed. Not dramatically. Men like Cross did not waste expression, but something behind his eyes opened sharp and unsettled. Callahan stared at the screen. The anesthesiologist glanced up, then stayed watching. Evie did not care who saw. She found the torn edge of the artery not by force, but by patience. The vessel had curled back under swollen tissue. She teased the surrounding fibers with movements so small they seemed more like thought than action. Dana whispered, "There." Evie answered, "I see it." She placed a temporary microclamp. The bleeding slowed. The room exhaled, but Evie did not. The proximal end was damaged. The distal end had retracted farther than expected. Primary repair would be tight if forced. Callahan had been wrong about length. Evie had been right, and there was no pleasure in it. "I need a vein graft," she said. Cross answered immediately. "Harvest site dorsal hand, small segment, minimal morbidity." Dana looked across. He nodded. "Do it." Evie shifted to the graft site. Her hands worked with the same impossible quiet. Cut, lift, preserve, irrigate, trim. No wasted motion, no roughness, no apology. The graft came free. She returned to the artery. The first anastomosis began. A hair-thin suture curved through the vessel wall. Evie placed it at the exact angle needed to avoid tearing the edge. She tied the first knot, then the second, the third. On the screen, the vessel edges came together like two halves of a broken promise being repaired. Callahan whispered almost to himself, "That's not possible." Cross did not look at him. "It's happening." Evie heard them, but their voices had moved far away. There was only the child. Only the hand. Only the field. Halfway through the repair, the generator hummed hard beneath the floor. The overhead lights flickered again. The monitor blinked, then stabilized. A low alarm sounded outside the room as another unit shifted to emergency power. The anesthesiologist said power is stable. Evie did not lift her eyes. "If the microscope goes, I need backup light on the field and manual magnification." Dana answered, already ready. Of course she was. The lights held. Evie continued. A small clot formed near the distal opening. She cleared it before it could enter the repair. The tissue was fragile from injury and time. One pull too hard would ruin the graft. One knot too loose would leak. One pause too long would cost perfusion. Her shoulders remained still. Her hands moved. Cross watched the monitor as though he were seeing surgery from a future he had not agreed to enter. "What is stabilizing you?" he asked quietly. Evie placed another stitch. "My foundation. That is not an answer. It is the only one I can give while I'm inside an artery." Cross said nothing more. The final stitch closed the first connection. Evie flushed the graft. No leak. Release proximal. Dana released. Blood entered the graft. Everyone watched. The repair held. Evie moved to the distal end. The second connection was harder. The tissue was smaller, more swollen, and the operating angle was worse. Callahan had damaged more than the visible portion of the artery when he tried to correct. Evie did not think of that as blame. Not now. Blame was for hallways and hearings. In the room, blame had no hands. She adjusted the microscope. Her prosthetic responded to the shift before her body needed to compensate. The socket tightened by a fraction. Her hip aligned, her spine quieted. Needle in, needle out, tie, irrigate. Again, again, again. The anesthesiologist said pressure stable. Dana said third digit still pale. Evie answered, "It won't be for long." She did not mean it as comfort. She meant it as instruction to the room. Believe the repair before fear contaminates the work. The last knot settled. Evie leaned back a fraction. Release distal. Dana released the clamp. For one terrible second, nothing changed. Mia's finger remained pale. Callahan's breath caught. Cross moved closer. Then color began to return. Not all at once, slowly. A faint pink blooming under the skin of the third finger, spreading from base to tip like dawn under ice. Dana checked Doppler. The sound came through the speaker, soft, then stronger. A pulse. Flow restored, Dana said, and this time her voice broke just enough for everyone to hear the human being under the uniform. The anesthesiologist confirmed saturation improving. Evie did not celebrate. There was more to do. The nerve, she said. Callahan looked at her as if she had lost her mind. You want to continue? Evie turned her eyes to him for the first time since scrubbing in. Mia wants to play piano. Then she returned to the field. The nerve repair required a different kind of patience. Vessels demanded flow, nerves demanded alignment. Too much tension and sensation might never return. Poor rotation and movement could become clumsy, painful, useless. The injury had bruised and compressed the digital nerve near the repaired vessel. Evie cleared the field. Cross stayed beside her now, no longer supervising from distance, no longer doubting openly. He observed with the severity of a man trying to understand what had just rewritten his assumptions. Evie approximated the nerve ends. Microsutures, even spacing. No twist, no crush. The room seemed to shrink around the work. Outside, the storm continued throwing rain against the hospital. Inside, the smallest structures of a child's hand became the center of the world. Callahan stood farther back now. His face had changed again. The fear was still there, but something else had joined it. Shame, maybe. Or the first painful edge of respect. The final nerve stitch seated cleanly. Evie irrigated the field. Check perfusion again. Dana checked. Strong Doppler signal. Color holding. Capillary refill improving. Cross looked at the hand, then at the monitor, then at Evie. How long were you under magnification? Dana checked the clock. 93 minutes since Captain Harper took over. Cross's eyes returned to Evie's hands. They never shook. Evie removed the instruments from the field. No, sir. The answer was simple. The room was not. They closed in layers. Callahan did not speak during closure. Cross assisted silently. Dana counted with the circulating nurse. The anesthesiologist lightened the anesthesia. Mia remained stable. When the dressing was finally placed and the splint secured, Evie stepped back from the table. Her legs held her, both of them. The biological one with muscle and bone, the pink one with carbon fiber code, and the stubborn refusal to be mistaken for weakness. Cross removed his gloves slowly. Captain Harper, stay after. Yes, sir. Callahan turned toward the door, but Cross stopped him. You too, Major. Callahan froze. Yes, sir. They waited until Mia was wheeled out toward recovery. Rachel would be told soon. Evie pictured the woman standing when she saw the team approach, searching their eyes before anyone spoke. She hoped Cross would tell her first. He had the rank for it, and more importantly, he had witnessed the whole thing. When the doors closed behind the gurney, the operating room felt suddenly too bright. Cross faced Evie. Explain what I just saw. Callahan looked between them. Evie untied her mask and let it hang around her neck. A repair. Cross's voice sharpened. Do not insult me. Evie met his eyes. The moment had arrived, but she was still standing in an operating room where a child's blood had been on the table minutes before. She could feel Anchor gradually stepping down system by system, returning her body to the ordinary instability of being alive. My prosthetic is not standard issue, she said. Callahan's gaze dropped to her leg. Evie hated that even now, after everything, his first instinct was still to look down. Cross noticed too. Look at her face, Major. Callahan's eyes lifted. Evie continued, it has an integrated stabilization system. Neural input, gyroscopic correction pressure sensing core compensation. It detects the movements that create physiological tremor and absorbs them before they reach my upper body. Cross stared at her. You built a tremor suppression platform into your prosthetic leg. Yes, sir. Without informing the department. Yes, sir. Callahan let out a breath. You operated with an undisclosed device. Evie looked at him. You operated with undisclosed arrogance. Mine saved the vessel. The word struck clean. Callahan did not answer. Cross held up one hand. Enough. Evie's pulse was suddenly loud in her ears. Not from surgery, from what came after. The room had seen her work. Now the institution would decide what to do with what it had seen. Cross stepped closer. Captain, this technology gave you an advantage in that room. Evie's jaw tightened. It gave Mia blood flow. That is not the same question. It is the only question that mattered while she was losing her hand. Cross looked at the closed doors through which Mia had been taken. For a moment his expression softened, then discipline returned. Who else knows? No one here, your chain of command. My prosthetic was approved as an adaptive mobility device. The surgical stabilization system is my own research. Callahan said research. You mean an experiment? Evie turned to him. No, I mean years of engineering and testing while people like you were busy laughing at the color. He looked away first. Cross said, Major Callahan, you will write an operative statement by 1700. It will be accurate. Yes, sir. You will include your vessel injury. Callahan swallowed. Yes, sir. You will also include Captain Harper's repair. His voice was quieter now. Yes, sir. Cross turned back to Evie. You will come to my office after recovery handoff. Bring every document you have on that prosthetic. Evie nodded. Yes, sir. He studied her one more time. There was no mockery in his eyes now, no pity either. Only the unsettled focus of a soldier recognizing an unfamiliar weapon on a battlefield. Evie did not like being seen that way, but it was better than not being seen at all. Outside the operating room, Rachel Walker stood the moment she saw them. Her hands were locked around the purple backpack so tightly her knuckles had gone white. Cross approached first. Evie stayed half a step behind him. Rachel searched their faces. Is she okay? Cross removed his cap. She is stable. Rachel's eyes filled immediately. Her hand Cross looked back at Evie. Then he did something no one expected. He stepped aside. Evie moved forward. We restored blood flow to the fingers. We repaired the damaged artery and nerve. There will be therapy and we have to watch for complications, but she has a real chance to use that hand. Rachel pressed one hand over her mouth. The piano, Evie felt the question in her chest. No surgeon can promise music. Rachel nodded, tears running freely now. Evie continued, but Mia still has the hand to try. Rachel broke then, not loudly. She folded inward, holding the backpack against her chest as if it were the child herself. Evie stood with her until the first wave passed. Then Rachel looked down and saw the pink prosthetic. This time she did not stare at it like a wound. She looked at it like it had carried Evie into the room where her daughter's future had been waiting. Thank you, Rachel whispered. Evie answered. She fought hard. Rachel shook her head. So did you. Evie had no reply. Behind her, Callahan stood near the OR doors, silent and pale, watching the mother of the child whose hand he had nearly lost thank the surgeon he had mocked. Cross watched too. The hallway lights reflected off the wet windows at the far end of the corridor. The storm outside had not stopped, but inside Fort Liberty Military Medical Center, something had shifted with the force of weather. Evie felt it in the way people looked at her as she walked toward recovery. Not softer, not kinder, sharper. They were no longer trying to decide whether she belonged. They were trying to understand what she was. She reached the recovery bay and saw Mia lying small beneath a heated blanket, her repaired hand elevated and wrapped monitors steady around her. The child was still asleep. Her face looked peaceful in the strange way children sometimes looked after, surviving things they would not understand until years later. Evie stood beside the bed for only a moment. Dana joined her, arms folded. You know they're going to make trouble about the leg. Evie kept her eyes on Mia's hand. I know. Dana looked at her. You saved her, Evie said. That will be of the trouble. The pulse monitor kept tracing green light across the screen. Steady, steady, steady. Evie turned toward the corridor leading to Colonel Cross's office. Each step sounded clear against the floor. Click, step, click, step. This time no one laughed. Colonel Cross's office was 3 floors above the operating suite, but the walk felt longer than any road Evie had taken under fire. The hospital had changed around her. Nothing obvious. No one stepped in front of her. No one saluted differently. No one said her name with open awe. Military hospitals did not turn miracles into applause while patients were still bleeding in other rooms. But people looked. They looked at her hands first now, then the leg. That reversal unsettled her more than the mockery ever had. Evie entered the elevator alone. The doors closed with a soft metal sigh. In the reflection, she saw a surgeon in blood-marked scrubs, surgical cap pulled low, eyes too calm for what had just happened. Her pink prosthetic showed beneath the fabric at her ankle, bright against the gray floor. The elevator hummed upward. Her body began to feel human again. The anchor system had stepped down fully after the operation, leaving behind the familiar ache in her hip and residual limb. The stillness was gone. Her pulse moved through her shoulders. Her breath shifted her weight. Every living body carried motion inside it. That was the thing no one understood until they watched through a microscope. The doors opened. Colonel Cross stood at the end of the hall outside his office, still in scrubs, arms folded, face carved into something unreadable. Callahan was already there. He had changed out of his gown, but not out of the defeat. It clung to him harder than blood. His hair was damp under the edge of his cap. His jaw was tight. His eyes avoided Evie's, then found them, then dropped again. Cross opened the office door. Inside, Evie entered first. The office smelled of black coffee paper and rain-soaked wool. Through the window, the storm had thinned into a gray curtain over the helicopter pad. The landing lights glowed on wet concrete. A black hawk sat idle in the distance, blades tied down, patient as a hunting bird. Cross did not sit behind his desk. That was the first sign this was not a normal debrief. He stood near the conference table. Captain Harper placed the device file on the table. Evie removed a sealed folder from her medical bag. It was thicker than Cross expected. Engineering notes, private test logs, prosthetic approval documents, mobility certifications, neural calibration report safety analyses, and the research protocol she had never submitted because she already knew what the first question would be. Can we stop you? She set it down. Cross did not touch it yet. Tell me exactly what is in your leg. Evie looked at Callahan, then at Cross. Adaptive Neural Stabilization Platform. I call it Anchor. Cross's eyes narrowed. What does it do? It measures motion through the prosthetic socket knee ankle and load sensors. It reads neural signals from my residual limb. It maps involuntary movement from heartbeat, respiration, muscle tension, and weight shift. Then it compensates through micro-adjustments before those movements travel into my upper body. Cross stared at her as if each sentence added a new charge to an indictment. In plain English, Evie held his gaze. It keeps my body quiet while my hands work. Callahan gave a short, humorless breath. So you built a surgical stabilizer into a prosthetic and walked into an operating room without telling anyone. Evie turned to him. I walked into an operating room after you tore a child's artery. His face tightened. Cross's voice cut in. Enough. The room settled back into restraint. Cross picked up the folder at last and opened it. He flipped through pages with the same controlled focus he used at the operating table. His eyes moved faster as the technical scope became clear. You designed this yourself? Yes, sir. Fabrication private lab access through a veteran medical innovation grant. Some components were custom machined, some were modified from commercial prosthetic systems. The neural interface is my design. You tested this on yourself. Yes, no institutional review board, no formal clinical trial, no department disclosure, no. The word sat heavily between them. Cross closed the folder. Do you understand the position you have put this hospital in? Evie felt the old heat rise, but she kept her voice flat. I understand Mia Walker has blood flow in her hand. That does not erase the question. No, It explains why the question came late. Cross stepped closer. Captain, a self-designed neural device was used during a pediatric military dependent surgery. If there is a complication, every lawyer, ethics officer, commander, and medical board between here and Washington is going to ask whether you were operating as a surgeon or testing an unapproved technology. Evie did not flinch. Then they should also ask whether the approved surgeon should have stopped when his hands started shaking. Callahan looked up sharply. For 1 second, Cross said nothing. Then he turned toward Callahan. Major, do not mistake silence for safety. Your operative statement is due in 2 hours. You will write what happened, not what protects you. Callahan's throat moved. Yes, sir. Leave us. Callahan hesitated. Cross did not raise his voice. Now. Callahan opened the door. Before he stepped out, he looked at Evie. There was anger there. There was humiliation. But beneath both something else had begun to form. A small fracture in the certainty he had carried for years. He left without speaking. The door closed. Cross walked to the window. For a moment, he seemed older than he had in the operating room. When I was in Kandahar, he said we had a young sergeant come in with both legs gone and half his abdomen open. His medic had clamped the bleeding in the field with one hand while holding pressure with the other. I remember thinking there was no way that medic should have stayed that calm. Evie stood very still. Cross looked back. That was you, wasn't it? Yes, sir. I read the report. I did not connect the name. Most people remember the injury more than the person. The words came out before she could stop them. Cross absorbed them. Then he looked at the pink prosthetic. I judged what I saw. Yes, sir. That nearly cost me the truth. Evie said nothing. An intercom crackled in the hallway. A nurse called for transport. Somewhere below, another emergency moved through the system. The hospital did not pause because one room had learned something. Cross returned to the table. I have to report this. I know. This will not stay inside Fort Liberty. I know. People will try to take the device from you. Some because they fear it. Some because they want it. Evie felt her fingers curl once, then release. It is of my body. Cross's voice softened by 1 degree. That will not stop them from calling it equipment. The sentence landed harder than she expected. Equipment could be inspected, restricted, classified, confiscated. A body was supposed to be harder to take. Supposed to be. Cross picked up the phone and dialed. Get Dr. Helen Ward on secure line, now. Evie knew the name. Everyone in military medicine knew the name. Dr. Helen Ward was the kind of bioethics investigator commanders requested when a case had become too dangerous for ordinary policy. Civilian title. Military clearance. Reputation for cutting through excuses with surgical efficiency. She had reviewed experimental battlefield blood products, neural implants for injured pilots, cognitive enhancement studies, and prosthetic control systems for special operations amputees. If Ward was coming, Anchor had already stopped being a secret. By late afternoon, Mia was stable in recovery. Evie checked on her twice. The hand remained warm. Doppler signals strong, swelling controlled. Rachel Walker sat beside the bed, one hand resting on her daughter's blanket, the purple backpack at her feet. Mia was still asleep. Rachel looked up when Evie entered. Captain Harper. Evie glanced at the monitor. How is she? She squeezed my finger. Evie stepped closer. With the injured hand, Rachel nodded, tears gathering again. Barely, but she did. Evie checked the splint, the dressing, the capillary refill visible at the fingertips. Barely counts. Rachel smiled through exhaustion. Colonel Cross said there may be questions. Evie's hand paused on the chart. Rachel noticed. About how you did it. Evie kept her voice even. There are always questions after a difficult surgery. Rachel looked at the pink prosthetic, then back to Evie's face. If anyone asks me, I'll tell them my daughter still has a hand, because you walked into that room. Evie tried to answer, but the words were not ready. Rachel reached for her daughter's backpack and pulled out the laminated recital card. She held it like a fragile medical record. She practiced for months, Rachel said. Her father watched on video from overseas. He told her when he came home she had to play it for him in person. Evie looked at Mia's small, wrapped hand. Then we protect the repair. Rachel nodded. Whatever they ask you, Captain, don't let them make you sound like the danger. That sentence followed Evie out of recovery and down the hall. Do not let them make you sound like the danger. At 1800, Dr. Helen Ward arrived. She did not look like an executioner. That would have been easier. She wore a charcoal suit, low heels, and no unnecessary expression. Her hair was silver at the temples, pinned back with military neatness despite her civilian clothes. She carried one leather briefcase and moved through Fort Liberty as if she already knew where every locked door led. Cross met her outside the secure conference room. Evie stood beside him. Ward looked at her badge, then her face, then her leg. Not the usual stare. A measurement. "Captain Harper." "Yes, ma'am." "I understand you had an unusual day." Evie replied, "A child had a worse one." Ward's mouth moved almost into a smile, then did not. "Let's begin." The secure conference room had no windows. The table was polished black. The walls were bare except for a clock, a framed medical command seal, and a screen showing encrypted connection status. A recording device sat in the center of the table. Cross sat to Evie's right. Ward sat across from her. A hospital legal officer took the far chair. Evie placed Anchor's documentation on the table. Ward opened a notebook. "This is a preliminary fact-finding review, not a disciplinary hearing. Captain Harper, do you understand?" "Yes, ma'am." "Do you understand that statements made here may lead to administrative ethical credentialing or legal review?" "Yes, ma'am." Ward clicked on the recorder. "State your name and role." "Captain Evelyn Harper, United States Army Medical Corps, surgical resident, Fort Liberty Military Medical Center. Did you use a personal prosthetic device during the operation on Mia Walker today?" "Yes." "Was the device approved by this hospital for surgical stabilization use?" "No." "Was it approved as a mobility prosthetic?" "Yes." "Does the device contain functions beyond ordinary mobility assistance?" "Yes." Ward's pen moved. "Describe those functions." Evie explained again. More slowly this time. "The sensors, the neural interface, the motion mapping, the tremor suppression, the difference between controlling her leg and stabilizing her surgical posture." Ward listened without interruption. That was not comfort. Good investigators let silence pull more from a person than accusation ever could. When Evie finished, Ward leaned back. "Captain Harper, does Anchor allow you to perform beyond ordinary human capability?" The room changed around the question. Cross's eyes moved to Evie. The legal officer stopped writing for half a second. Evie answered carefully, "It allows me to reduce tremor beyond ordinary human baseline." That sounds like yes. It sounds like a narrow answer to a broad question. Ward's eyes sharpened. "Then give me the broad one." Evie placed both hands flat on the table. "Anchor does not know anatomy. It does not make decisions. It does not identify arteries or protect nerves. It does not make me brave. It does not make me competent. It stabilizes the foundation I operate from." Ward said, "A foundation that makes your hands steadier than Colonel Cross's." Cross did not react. Evie said, "In certain microsurgical conditions, yes. Steadier than Major Callahan's. Yes. Steadier than most surgeons. Yes." Ward tapped her pen once. "Then why is this not enhancement?" Evie had known the question was coming. Still hearing it spoken made something old and angry rise inside her. "Because I did not begin from the same baseline. Explain. I lost of my leg in combat. My body was changed without my consent. The prosthetic restores function." Ward leaned forward. "It restores more than function. It restores function well. It affects your hands. It affects the instability that travels to my hands. Captain, if a runner loses a leg and receives a prosthetic that makes him faster than able-bodied runners sporting bodies have struggled with, whether that is compensation or advantage. I am not running for a medal. I am repairing children's arteries." The legal officer glanced up. Ward held Evie's stare. "The ethical principle is still relevant." Evie's voice lowered. "Then apply all of it. Glasses can correct vision better than average. Cochlear implants can restore hearing in ways that process sound differently than natural ears. Night vision lets soldiers see what eyes cannot. Robotic systems filter tremor from surgeons every day. We do not call those people less human because the tool helps them exceed a biological limit. Ward said those tools are disclosed, approved, and regulated. And they became regulated because someone built them before the rule existed." Silence. Cross shifted slightly, not to interrupt, but because the sentence had struck something. Ward looked down at the file. How many prototypes? 12. How many failed? 11. Any injuries during development? Evie hesitated. "Yes, specify. Skin breakdown, nerve feedback syncope, falls, socket trauma, 1 mild concussion. Cross turned toward her. That detail had not been in the folder's summary. Ward noticed. You tested a neural prosthetic on yourself until you passed out, yes. Why, Evie looked at the table surface. Under the bright conference room lights, she could see the faint tremor in her own left hand now that Anchor was not fully engaged. Tiny, normal, human. Because after the amputation, everyone kept telling me what I could still do. Teach, consult, research, administer. They were trying to be kind, but every kind suggestion moved me farther from the operating room. She looked back up. I did not want a life adjacent to the work. I wanted the work. Ward's expression changed slightly. Not sympathy. Recognition. And the pink shell? The question surprised Cross. Evie gave a small breath. That is not technical. It may be relevant. How? Because the device is both medical equipment and visible identity. I am trying to understand the person attached to the technology. Evie considered refusing the question. Then she thought of Rachel Walker saying not to let them make her sound like the danger. I chose pink because flesh tone felt like hiding. Black felt like grief. Pink felt like I was allowed to exist loudly. Ward wrote that down. For reasons Evie did not understand, that was the note that made her throat tighten. The hearing continued for another hour. They asked about power failure, manual override, cybersecurity risk, battery life, sterility concerns, whether the device transmitted data, whether Anchor could be hacked, whether it could misread neural signals during fatigue, whether the tremor suppression could create overconfidence, whether a patient had the right to know if their surgeon used adaptive technology, whether the Army had rights to inventions developed by active duty personnel, whether Evie had violated disclosure rules by not identifying the stabilization system before operating. Each question was a blade. Some were fair. Some were fear dressed as policy. Evie answered all of them. By the end, her hip ached and her residual limb burned inside the socket. She did not shift in her chair. She would not give the room the satisfaction of seeing pain at the exact moment they were deciding what kind of body she had. Ward finally closed the notebook. Preliminary assessment. The legal officer sat straighter. Cross looked at Ward. Evie waited. Ward said Anchor appears to function primarily as an adaptive prosthetic platform. Its surgical stabilization benefits are significant and may exceed ordinary compensatory use, but the device is integrated into Captain Harper's mobility system and does not independently perform medical judgment or surgical action. Evie felt air return to her lungs but did not let it show. Ward continued. I am not recommending immediate suspension of Captain Harper's surgical duties. Cross nodded once. The legal officer wrote quickly. However, Ward said. There was always a however. The device requires restricted disclosure, technical review, and supervised use pending formal classification. Captain Harper may continue operating under Colonel Cross's authority, provided patients are informed when the stabilization function is clinically relevant. Evie said, informed how Ward looked at her. Honestly. The answer was simple and impossible. Ward gathered the documents. Additionally, this technology has broader military medical significance. If it reduces tremor in microsurgery, it may improve outcomes beyond amputee surgeons. It may also expand surgical access for physicians with mobility or movement disorders. That raises research obligations. Cross said the hospital is prepared to support review. Ward looked at Evie. That depends on whether Captain Harper is willing to stop treating this as a secret. Evie almost laughed. A bitter thing. It was a secret because every room made the leg the first argument against me. Ward's voice softened. Then make the device the first argument for others. Evie did not answer, because that sounded noble, and noble things often cost the person who had already paid too much. The meeting ended at 2100. When Evie stepped into the hallway, the hospital felt quieter than it should have. Night shift had taken over. The day's noise had lowered into monitors, distant carts, and the soft murmur of nurses at stations. The rain had stopped. Water clung to the windows in silver streaks. Callahan waited outside the conference room. Evie stopped. He looked like he had been there for a while. I submitted the statement, he said. Evie did not respond. I wrote it accurately. Good. His jaw tightened. I included the vessel injury. Good. He looked down the hall, then back at her. I also wrote that you saved the repair after I failed to maintain control. That made her pause. Callahan swallowed. I need to say something, I'm tired. I know, she should have walked away. She did not. He looked at her leg, then forced himself to look at her face. I hated you before I knew you. Evie's expression did not change. That is not an apology. No, it is the ugly before one. The hallway hummed. He continued. When you arrived, everyone talked about your record. Prior combat medic, Hopkins, engineering degree, perfect evaluations. Then I saw the leg and I told myself the record had to be inflated because the alternative was worse. What alternative that you had done all of that with less room for error than the rest of us? Evie felt the words enter carefully like something sharp being placed on a table. Callahan's voice dropped. I mocked you because it was easier than admitting I was scared you might be better. Evie looked at him for a long moment. Did you write that in your statement? His face tightened. No. Then start there next time. She moved past him. He spoke behind her. Harper. She stopped, but did not turn. I'm sorry. The words were quiet, not polished, not enough, but real enough to remain in the hallway after she walked away. Colonel Cross found her in the observation gallery above recovery. Mia slept below. Her mother curled in a chair beside her. The purple backpack sat against the wall. The repaired hand was elevated, wrapped in white fingers visible at the edge of the splint. Pink fingertips. Warm. Alive. Cross stood beside Evie without speaking at first. Then he said, Ward will not bury this. No. Neither will command. No. They may want a program. Evie kept her eyes on Mia. They may want control. Both can be true. She glanced at him. That seems to be the phrase of the day. Cross almost smiled. Then his face grew serious. I spent 30 years believing the best surgeon in the room was the one whose body could endure the most punishment without assistance. Evie said, That belief has a body count. Cross accepted it. Yes. Below them, Rachel stirred in her chair and reached for Mia's blanket without waking. Cross placed a folder on the ledge in front of Evie. She looked down. Adaptive Combat Surgery Initiative. The title sat in stark black letters. Evie did not touch it. Cross said, This is a draft. Nothing formal. Ward asked whether we had infrastructure for adaptive surgical technology research. I told her we could build it. You told her that today, I told her after watching a child's finger turn pink because your so-called limitation did what my hands could not. Evie read the first page through the clear cover. Pilot program. Tremor stabilization research. Adaptive operating platforms. Recruitment pathway for disabled medical personnel. Partnership with engineering institutions. Clinical simulation lab. Her name appeared halfway down the page. Program lead. She looked at Cross. I'm a resident. You are also the reason this document exists. I have surgeries training boards patients. Yes. And you want to add a military research program on top of that. Cross looked down into recovery. I want you to help us stop wasting people. Evie went still. He continued. There are medical students, residents, medics, and surgeons who have been pushed away from operating rooms because their bodies did not match the old expectation. Some should not operate. That is true of able-bodied people too. But some were never given the right tools or the right evaluation or the right chance. Evie looked back through the glass. Mia's mother was asleep now, one hand still touching the blanket. Cross said, You do not have to answer tonight. Evie reached for the folder. The paper felt heavier than it should have. Down below, Mia's fingers moved. Barely. A small twitch against the splint. Rachel woke at once and leaned forward, whispering something Evie could not hear through the glass. Evie watched the child's fingertips shift again, pink and stubborn under the soft recovery light. Then she opened the folder. Evie did not say yes that night. She read the first page in the observation gallery while Mia Walker slept below with one repaired hand lifted in its splint. She read the second page while Colonel Cross stood beside her in silence. By the third page, her residual limb was aching badly enough that every word on the document seemed to pulse with it. Program lead. Adaptive surgical technology. Clinical trials. Disabled medical personnel recruitment. Military medical innovation pathway. All of it sounded clean on paper. Paper was good at that. Paper could take pain and make it look organized. It could turn a battlefield into a report. A lost limb into a disability, rating a child's hand into a case number, and a surgeon's life into a proposal. Evie closed the folder. Cross watched her. "You think this is an opportunity," she said. "I think it is one. I think it is a second battlefield." Cross did not deny it. From below, Rachel Walker shifted in her chair and reached toward Mia without waking. The motion was small, automatic, maternal. Even asleep, Rachel's body was still guarding the child. Evie looked back at the folder. "If I lead this, they will put me under a microscope." Cross said, "They already have." "No," they stared at the leg. "That is different." Cross accepted the correction with a slight nod. Evie touched the clear cover with 2 fingers. "They will question every case, every outcome, every movement. If I succeed, they will call it the device. If I fail, they will call it proof. Yes. You say that very calmly. I'm not the one who has to live inside the answer." That was the first honest thing anyone had said about the proposal. Evie opened the folder again. Through the glass, Mia's wrapped fingers twitched once more. Rachel woke fully this time and leaned over the bed. Her lips moved. Evie could not hear the words, but she knew the shape of prayer when she saw it. Evie thought about every room where someone had looked at her leg and lowered their expectations. She thought about the residents in the hallway, Callahan's smile, Cross's first doubt, the skills lab, the hidden prototypes in her apartment, the nights she had stood alone with pain running up through nerves that ended in empty air. Then she thought about the people who had never made it as far as she had. The med student with a tremor who was told to choose radiology. The veteran medic with a spinal injury who was told the operating room had no place for a chair. The resident who lost hearing in a blast and was quietly pushed away from trauma. The brilliant hands that never reached the table because the doors closed before anyone tested them. Evie looked at Cross. "I will not let this become a publicity program. It will not. I will not be photographed beside technology while the hospital keeps rejecting people quietly." Cross said, "Then build the standard." Evie held his gaze. "If command tries to take anchor from me, I walk." Cross answered without hesitation, "I will put that in writing." She almost smiled. "Careful, sir." That sounded like trust. Cross looked down through the glass at Mia's hand. It sounded like evidence. 6 months later, the old storage wing beneath Fort Liberty's Surgical Education Center no longer smelled like dust and forgotten equipment. It smelled like antiseptic machine oil, warmed plastic, and coffee. The sign outside the door was simple: Adaptive Combat Surgery Initiative. Inside the room never stayed quiet for long. Motion capture cameras tracked residents at practice tables. Surgical simulators blinked with vascular repair modules and battlefield trauma drills. Prosthetic components sat beside microscopes. Stabilization braces hung on charging racks. Engineering students argued with trauma nurses over calibration. Army medics practiced knot tying beside civilian fellows. A wall of monitors displayed tremor maps, stance data, breath patterns, and instrument motion. At the center of it all stood Captain Evelyn Harper. Pink prosthetic visible, scrub sleeves pushed up, voice calm enough to cut glass. "No," she said. A second-year resident froze with the needle driver halfway through a synthetic artery. Evie stepped closer. "You are chasing the vessel." The resident swallowed. "I thought I had the angle. You had an angle." The tissue had a different opinion. A few people around the table tried not to smile. Evie ignored them. She reached forward, repositioned the resident's wrist with 2 fingers, then tapped the edge of the simulator. "Let the instrument arrive before your ego does." From the far side of the room, Major Grant Callahan gave a short laugh. The resident looked horrified. Evie glanced over. Callahan lifted both hands. She is right. That was new. In the months after the Walker surgery, Callahan had not transformed into a saint. Evie would not have trusted that. He was still ambitious, still sharp, still too fond of the last word, but something fundamental had cracked open in him, and instead of sealing it with pride, he had let the crack become useful. He had requested assignment to the initiative after his surgical review ended. Cross had nearly refused. Evie had not. When Cross asked why, she said he knows what arrogance looks like from the inside. Callahan proved useful for exactly that reason. He could spot performance confidence turning into dangerous pride before younger residents could name it. He was hard on them, sometimes too hard, but he no longer aimed cruelty at weakness. He aimed discipline at blind spots. One morning, a new intern stared too long at Evie's prosthetic while she adjusted a simulator. Callahan saw it from across the room. "Lieutenant," he called. The intern snapped upright. "Yes, sir. What are you supposed to be watching?" The intern flushed. "Her technique, sir." "Then watch her technique." Evie did not look up. But later, when Callahan passed her at the instrument sink, she said, "That was almost decent." He dried his hands. "I live for your praise. Do not." "Yes, ma'am." The initiative drew attention faster than anyone expected. At first, the attention came from within military medicine. Trauma chiefs wanted data. Command wanted risk assessments. Walter Reed wanted consultation access. San Antonio wanted simulator trials. Duke sent engineers. Georgia Tech sent graduate students. The Army sent observers with clipboards and expressions that suggested they were trying to decide whether Evie had invented a surgical training revolution or an administrative headache with legs. The answer Cross told them was both. Evie hated the visitors. Not because she feared scrutiny, because visitors liked stories too much. They wanted the pink leg, the wounded soldier, the child's hand, the emotional arc. They wanted to stand near the lab and feel history happening without touching the hard parts. Evie made them watch data instead. She showed them how ordinary surgical tremor traveled through the body. She showed them the difference between hand instability and foundation instability. She made them watch 3 residents perform the same vessel repair with and without posture feedback. She made them listen to nurses explain how fatigue changed instrument handling during long cases. She made them stand for 2 hours at a microscope before they were allowed to ask whether Anchor was inspiring. Once a visiting administrator said, "This program is a wonderful symbol." Evie looked at him. "It is a clinical tool." He laughed politely. She did not. By the end of the visit, he had stopped laughing. The first real test of the initiative came on a Tuesday morning in September. Evie was reviewing tremor data when Dana Ellis appeared at the door. "You have an interview." Evie did not look away from the screen. "I have 3 this afternoon. This one is early. Then this one can wait." Dana leaned against the doorframe. "She has cerebral palsy, medical student, drove from Tennessee. Looks like she has been told no by people who enjoyed saying it." Evie's hand paused above the keyboard. "What is her name?" "Lena Brooks." Evie closed their file. "Send her in." Lena Brooks entered with a folder pressed against her chest and a posture built from years of bracing for disappointment. She was 26, slight dark-haired with clear brown eyes that moved quickly around the room, taking in the equipment, the cameras, the prosthetics, the surgeons, the exits. Her right hand trembled faintly at her side. She tried to hide it by holding the folder tighter. Evie noticed. Evie also noticed the way Lena's gaze settled briefly on the pink prosthetic, then moved back to her face. "Good. That mattered." "Ms. Brooks," Evie said. "Captain Harper, sit down." Lena sat. Her folder remained clutched against her ribs. Evie took the chair across from her rather than the one behind the desk. "Why surgery?" The question landed too fast. Lena blinked. "I'm sorry everyone asks why you think you can do it. I am asking why you want it." Lena looked down at her folder. "My father was a mechanic. He used to say every system told a story if you knew how to open it carefully. Engines, radios, people. I liked the where careful hands could change the ending." Evie waited. Lena continued quieter. "When I was 11, my appendix ruptured. The surgeon came to see me afterward. She explained what she had done like I was smart enough to understand it. I decided then. And the cerebral palsy." Lena's mouth tightened as if the words had been dragged from her too many times. "Mild, spastic hemiplegia, mostly right side. Fatigue and stress make the tremor worse. I have adapted for exams, labs, procedures, almost everything. But surgical programs see the hand and stop listening." Evie said, "What did your last evaluation say?" Lena's grip on the folder tightened. "That I have strong diagnostic reasoning, excellent anatomy knowledge, and insufficient fine motor reliability for operative training." Evie heard the phrasing. Clean words, administrative words, a door closing quietly. "What did they miss?" Evie asked. Lena looked up. For the first time, anger showed through the nerves. "They tested my hand under observation, not my ability to adapt. They gave me standard instruments, standard posture, standard timing, standard everything. Then they called my body the problem." Evie leaned back. "That sounds like lazy testing." Lena stared at her. No one had said that before. not to her face. Evie stood and crossed to a simulator. She picked up a microneedle driver and placed it on the table between them. "Show me." Lena's eyes widened. "Now, this is a surgical lab. We do fewer speeches when instruments are available." Lena stood slowly. At the practice station, she put her hands beneath the scope. Her tremor increased immediately. Not severe, but visible. The awareness of being watched made it worse. That was common. Bodies developed their own humiliating sense of timing. She tried to place a stitch in the synthetic vessel. The needle drifted. She corrected. Overcorrected. The vessel wall tore. Lena closed her eyes. "I'm sorry," Evie said. "For what I know, that was bad." "Yes." The bluntness startled her. Evie stepped beside her, but it was also useful. Lena opened her eyes. Evie pointed to the monitor. "Your planning is good. You identified the entry point before your hand betrayed the plan. Your tremor spikes with visual pressure and wrist extension. Your shoulder tries to compensate, which makes the fine movement worse. Your problem is not surgical thinking. It is interface and stabilization." Lena's face changed. The words did not erase the wound, but they named it differently. Interface, stabilization, not failure. Evie turned to Dana. "Bring prototype forearm rig 3. Dana raised one eyebrow. "That thing hates everybody, so did version 9. Dana disappeared into the equipment room. Lena looked at Evie. "You really think there is a tool for this?" Evie said no. Lena's face fell. Evie continued, "I think there is not a tool yet." That afternoon became the first of many. The initial brace was ugly, uncomfortable, and overconfident. It wrapped from Lena's forearm to the back of her hand using motion sensors and resistance feedback to dampen involuntary movement. It corrected too late, then too strongly, then not at all when fatigue changed her pattern. On the third day, Lena threw the brace onto the padded table and stepped back with tears in her eyes. "I can't do this." Evie looked up from the calibration screen. "You can't do this version. I tore the vessel 6 times. 7. Lena gave her a furious look. "Thank you. Accuracy matters. I am serious. So am I." Lena's voice cracked. "You do not understand what it is like to be told your body makes you unsafe." The room went silent. Dana looked away. Callahan, near the simulator wall, stopped mid-note. Evie did not move for several seconds. Then she reached down, released the socket lock on her prosthetic, and removed the pink leg. The room stilled in a different way. Evie placed the prosthetic on the table between them. Without it, she stood balanced on her right leg with one hand resting lightly on the edge of the station. Not helpless, not dramatic, just present in the truth of her body. "This is version 12, she said. Lena's anger faltered. Evie nodded toward the equipment shelves. "The first 11 failed. One made my nerve endings feel like they were on fire. One tore my skin open. One made me fall into a workbench hard enough to crack a rib. One worked beautifully for 20 minutes, and then the knee locked while I was crossing a parking lot." Lena stared at the prosthetic. Evie continued. "After version 11 failed, I sat on my kitchen floor for 2 hours and thought maybe everyone was right. Maybe surgery was something I used to be on the way toward. Maybe the kindest thing was to stop." Her voice stayed steady, but the room heard the cost underneath it. "Then I got angry. Anger is not wisdom, but it can be fuel if you do not let it drive." She pushed the brace gently back toward Lena. "You are not proof that this cannot work. You are data that the current design is not good enough." Lena wiped her face with the heel of her left hand. "That sounds less poetic than impossible." "Good. Poetry does not pass safety trials." Callahan cleared his throat from across the room. "For what it is worth, Brooks, my first vessel repair looked like a raccoon did it in a moving truck." Lena looked at him. "Is that supposed to help?" He considered. "No, but it is true." For the first time that day, Lena laughed. "They rebuilt the brace. Not once. Many times. They changed the wrist angle, adjusted resistance timing, added fatigue, sensitive calibration, built a softer hand interface, rewrote the tremor prediction model so it responded to Lena's actual motion instead of a generic movement disorder profile. They trained under silence first, then noise, then simulated pressure, then timed scenarios, then observed scenarios with people standing too close on purpose. Lena hated that drill most. Evie insisted on it. "Rooms have eyes," she said. "We train for the room, too." Weeks became months. The first successful synthetic vessel repair took Lena 18 minutes. She cried afterward and pretended the microscope light had bothered her eyes. The first cadaver procedure took 4 hours. She vomited afterward in the staff bathroom, then came back and asked to review her mistakes. Evie approved of that. The first live case did not come quickly. Ward's review board demanded data. Cross demanded safety. Evie demanded that Lena be ready, not just symbolic. Lena demanded a chance. 18 months after she first walked into the lab clutching her folder, Lena Brooks stood scrubbed beside an attending surgeon in operating room 2. The case was a straightforward appendectomy on a young enlisted soldier. Routine for Fort Liberty, not routine for Lena. Evie watched from the gallery with Cross and Callahan beside her. Below, Lena stood in surgical stance with the forearm stabilizer integrated beneath a sterile sleeve. The device gave no dramatic sound, no futuristic glow. It simply rested against her arm and listened to the movement others had mistaken for impossibility. The attending said, "Make the incision." Lena inhaled. Her right hand trembled once. The stabilizer adjusted. She exhaled. The scalpel moved. Clean line. Evie's fingers curled around the gallery rail. Cross noticed. "You nervous?" Evie did not look away. "Yes." Callahan said, "She is ready." Evie glanced at him. He shrugged. "She terrifies the interns. That is usually a sign." Below, Lena moved through the procedure with careful confidence. Not flawless. No real surgery was flawless, but safe, thoughtful, precise. When she hesitated, she named the problem. When the tissue resisted, she adjusted. When the attending asked for her plan, she gave it clearly. The appendix came free. The stump was secured. The field was clean. The attending stepped back. Close. Lena's eyes lifted for half a second toward the gallery. Evie gave one nod. Only one. It was enough. After the surgery, Lena found Evie in the corridor outside recovery. She was still in scrubs mask, hanging loose eyes, bright and stunned. "I did it!" Evie said. "You did." "No," Lena said, laughing once through tears. "I mean, I actually did it." Evie understood the difference. Doing a thing in theory lived in the mind. Actually doing it entered the body and rearranged the future. Lena looked down at her hands. "They told me the tremor would always be the end of the story." Evie said, "They lacked imagination." Lena looked up. "No, they lacked you." Evie hated sentimental moments. They were unpredictable and usually messy, so she said, "Do not make me regret accepting you." Lena laughed harder, then wiping her face. "Yes, ma'am." That winter, Mia Walker returned to Fort Liberty. The hospital arranged a small rehabilitation ceremony in the education auditorium. Evie tried to avoid it. Rachel Walker made that impossible by sending 3 messages, one through Cross, one through Dana, and one through Callahan, which Evie considered unfair use of hostile channels. The auditorium filled with nurses, therapists, surgeons, residents, and a few military families. Mia walked in holding her mother's hand. She was 9 now, taller, braver in the way children became brave when adults stopped acting like they were made of glass. Her right hand still had scars. Fine, pale lines along the fingers and palm, evidence of injury, evidence of repair, evidence of survival. At the front of the room sat a small keyboard. Mia climbed onto the bench. Rachel stood nearby with both hands pressed to her mouth. Evie remained near the back wall, arms folded, hoping no one would make her speak. Cross stood beside her. "You could sit down. I could transfer to dermatology too. Some choices are wrong." He almost smiled. Mia placed both hands on the keys. The first notes were uneven, then steadier. Not concert hall perfect, not untouched by injury, not the fantasy version of healing where scars vanish and the past becomes pretty. It was better than that. It was real. Claire de Lune, the easy part, played by a child whose hand had almost been surrendered to the limits of other people's confidence. Evie felt the sound move through the room. Dana wiped her eyes openly. Callahan looked at the ceiling like he was inspecting the lights. Cross did not move at all. When Mia finished, the applause came softly at first, then full. Mia beamed. Rachel cried. The therapists clapped the loudest. Mia ran straight past the front row to Evie. Evie barely had time to brace before the child wrapped both arms around her waist. "Captain Harper, I played it. I heard. With both hands, I saw." Mia stepped back and held up the repaired one. Strong hand. Evie looked at the fingers, the scars, the small tremor of effort. Very strong hand. Mia pointed at the pink prosthetic. Strong leg. Evie nodded. Fair trade. Rachel reached them a moment later. She took Evie's hands in hers. My husband watched the video 3 times before he called. He said to tell you he owes you more than he can say, Evie answered. Tell him Mia did the hard part. Rachel smiled. She says the pink leg saved her song. Evie looked down at Mia, who was already showing Dana how far her fingers could stretch. The room blurred for a second. Evie blinked it clear. 3 years after the hallway where Combat Barbie was whispered behind her back, Evie walked onto a stage in San Antonio at the National Military Medicine Conference. The hall was full. Surgeons in dress uniforms, civilian trauma chiefs, prosthetics engineers, command staff, rehabilitation specialists, medical students, veterans, people who had come to hear about Anchor adaptive surgical platforms, tremor control, and the program at Fort Liberty that had become too successful to dismiss. Evie stood behind the podium in her dress uniform. The pink prosthetic was visible beneath the hem. She had made sure of it. On the screen behind her was an image of an operating room. Not dramatic, not staged. Just hands under a microscope repairing a vessel that looked too small to matter unless it belonged to someone you loved. Evie looked out at the crowd. For once, she did not search for judgment. She knew it was there. She no longer arranged her life around it. My name is Captain Evelyn Harper, she began. I am a trauma surgeon in training, a biomedical engineer, a combat veteran, and an amputee. The hall settled. 3 years ago in a hallway at Fort Liberty, residents laughed at my prosthetic. They called me Combat Barbie. A few people shifted in their seats. Evie continued. They were not creative, but they were confident. A low ripple moved through the crowd. She let it pass. They saw the color before the engineering. They saw the limp before the record. They saw the wound before the surgeon. On the screen, the image changed to motion data. Tremor lines, stance mapping, instrument tracking. Military medicine taught me that survival often depends on adaptation. We improvise in field hospitals. We turn cargo space into operating space. We use technology to extend vision, stabilize instruments, move blood-preserved limbs, and bring people home. But when the person needing adaptation is the surgeon, not the patient, we become strangely conservative. Cross watched from the front row. Callahan sat beside him. Lena sat 2 seats down in uniform, her stabilizer resting discreetly beneath her sleeve. Evie clicked to the next slide. Mia's hand appeared before and after repair. No face, no name, just the clinical evidence of a future almost lost. This was the case that forced our institution to ask whether adaptive technology was compensation, enhancement, or something we had not yet learned to name correctly. She looked over the room. The question matters. Regulation matters, disclosure matters, safety matters, but fear cannot be allowed to disguise itself as ethics, and tradition cannot be allowed to call itself patient protection when it is really protecting comfort. No one moved. Evie stepped away from the podium. The Adaptive Combat Surgery Initiative has now trained surgeons and medical students with limb loss tremor disorders, spinal injuries, hearing differences, and other physical conditions that once pushed them out of operating rooms before their skills were honestly measured. Not all of them became surgeons. That was never the promise. The promise was a fair test with the right tools. The screen changed again. Lena in the operating room, a veteran resident using an adjustable seated platform, a hearing-impaired surgical fellow working with visual alert systems, a prosthetic-armed medic practicing vascular control, Mia playing piano. Evie heard the room react to that one. She let the image stay longer than the others. Then she said, a normal body is not a credential. A different body is not a disqualification. The credential is competence. The obligation is proof. The tool is whatever lets trained hands do the work safely. Applause began before she finished. She waited. It grew. Not because the audience was kind, because data had met story and neither had backed down. After the speech, people surrounded her. Surgeons wanted collaboration. Engineers wanted specifications. Command staff wanted timelines. Medical students wanted to know whether Fort Liberty accepted observers. A reporter asked whether Evie considered herself a symbol. Evie answered, I consider myself on duty. That quote traveled faster than she expected. By evening, she was exhausted enough to feel hollow behind the eyes. She escaped through a service corridor near the back of the conference center and found Callahan waiting by a vending machine. He held out a bottle of water. She took it. "If this is poisoned, your technique has become subtle." He said, "I am growing." She opened the bottle. He leaned against the wall. "You were good up there. High praise from the man who once called me a pink kickstand." He flinched slightly. "I deserved that." "Yes." He looked down the empty corridor. "I still remember the hallway, the first one, before the Walker case." "So do I. I remember thinking I was being funny. You were not." "No." For a while, neither spoke. The distant conference noise faded behind the service doors. Callahan said, "I thought, if you belonged, it meant I was less special." Evie looked at him. "That is a small room to live in." "I know that now." She took a drink of water. He continued, "I requested permanent faculty assignment to the initiative." Evie lowered the bottle. "Cross told me. You did not object, I considered it. And you are useful." Callahan smiled faintly. "That is the warmest thing you have ever said to me. Do not get comfortable." He nodded. Then his face turned serious. "I am sorry, Evie, for the jokes, for the doubt, for making you prove what I should have been willing to see." She studied him. Apologies were strange instruments, often dull, sometimes sharp enough to cut a path forward. "Do better with the next person," she said. "I will. That is the apology." He nodded once. Understood. Her phone buzzed. A message from Rachel Walker. There was a video attached. Evie opened it. Mia sat at a real piano this time, not a hospital keyboard. Her father stood in the background in uniform home from deployment, one hand pressed over his mouth as his daughter played. The song was still imperfect, still careful, still beautiful. Under the video, Rachel had written, "She says the pink leg saved her song." Evie stared at the screen. Callahan saw her expression and wisely said nothing. Later that night in her hotel room, Evie removed the prosthetic and set it beside the bed. The city lights of San Antonio burned beyond the window. Traffic moved below like red and white blood cells through dark arteries. Her dress uniform hung over a chair. Her speech notes lay scattered on the desk. The conference badge sat beside her phone. She sat for a long time in the quiet. Without the prosthetic, her body felt both lighter and less complete. The ache in her residual limb rose and fell. Phantom sensation curled where her foot was not. She let it exist without fighting it. Some pain did not need victory. It needed witness. Her phone buzzed again. A message from Lieutenant Colonel Ann Reeves, the surgeon who had stood beside her bed years ago at Walter Reed. Saw the speech. "You did not lose your hands. You used them to open a door the rest of us should have built sooner." Evie read it twice. Then she typed back. "Still standing," Reeves replied almost immediately. Loudly, I hope. Evie looked at the pink prosthetic beside the bed. "Yes, ma'am." She slept for 4 hours. At 04:17, her phone rang. Not the soft tone of a message, the hard tone of Fort Liberty Command Relay. Evie sat up instantly. Her hand found the prosthetic before she was fully awake. Cross's voice came through the line. "We have a training aircraft down outside Fayetteville. Multiple casualties inbound. Pediatric dependent on site with severe facial trauma. Weather is clear, but the first surgical wave is short-staffed." Evie was already attaching the socket. "Who is available? Callahan is en route. Dana is assembling trauma team 2. Lena is asking to observe." Evie locked the prosthetic into place. The click sounded sharp in the dark room. "Tell Lena to scrub if she is ready." A pause. Cross said, "Is she?" Evie stood. "She will tell us if she is not." She grabbed her bag, her jacket, and the conference badge she had forgotten to remove from the desk. The hallway outside her hotel room was empty. Her reflection moved across the elevator doors as she passed, uniform half-buttoned hair pulled back, pink carbon fiber visible below black fabric. By the time she reached the lobby, a military vehicle was waiting outside with lights flashing silently. The driver opened the door. Captain Harper Evie stepped into the rain-damp morning air. Yes. As the vehicle pulled away, the city slid past in streaks of amber light. Her phone buzzed once more, a text from Lena. "I am scared," Evie answered. "Good. Bring the fear. Do not let it hold the instrument." The reply came a moment later. "Yes, ma'am." Evie looked out at the road ahead. Another hospital, another operating room, another body on the edge of being written off by time trauma or fear. The world kept offering impossible cases as if impossible were a diagnosis. She flexed her hands once, steady enough, human enough, ready enough. At Fort Liberty, the ambulance bay doors opened as the first sirens arrived. Rainwater shone on the concrete. Medics shouted over engines. Nurses ran stretchers into the light. Cross stood at the trauma entrance in scrubs, already issuing orders. Callahan moved beside him, focused and calm. Lena stood near the scrub station, pale but present, her stabilizer secured beneath her sleeve. Evie crossed the bay. Click, step, click, step. No one laughed. No one looked away. The doors opened before her, and the bright violence of the trauma ward swallowed her whole.